My name is Tanya Black, and I live with pain every day. I take a cocktail of powerful opioids, like oxycodone.
I've been taking them for about 2 years now.
They work, sort of, but I'm worried about what they're doing to my body long term, and if I'll get addicted. I want a potentially safer alternative.
What we do know about cannabis is the chances of overdose and death are very remote. Whereas with opioids, morphine, paracetamol, alcohol, all three of those, with overdose, you have death.
I've sort of been told by some people that you are able to get medicinal cannabis in New Zealand. You know, it's not funded. I feel like this could be a solution, but just trying to find out how I even get to try something.
So, will my doctor support me? Or is my pursuit of pot as out of reach for people like me as it's always been?
Every time I get in my car, they start like this. So I get these spasms anytime, like when I'm driving, any time of the day, several times a day. And it's just really annoying because I can't predict it and I don't know what happens. It gets painful if they go on and on for a while, and then it gets quite sore in my lower back. It's more exhausting than anything and just irritating.
Tanya's spasms result from injury that left her in a wheelchair 10 years ago.
Okay, so this is me back in the 90s, living it up in London. Traveling around Europe, working really hard, and probably partying just as hard. And this is the Auckland building, the converted warehouse where I used to live. I was just rushing home from work one day, ran to the top step, slipped out of my shoe, fell backwards onto the landing, broke my back. I was paralyzed from the waist down. Life in a wheelchair I've kind of gotten used to, and things really aren't too bad. But it's just this one thing that really affects my quality of life.
To cope, Tanya takes a sleeping tab most nights, as well as strong opioids.
I've been taking them for about 2 years now, and I think that's probably what it's doing to my body is not good, and I rely on them because the spasm makes my lower back hurt. So sometimes I also take sleeping tablets. If it's really bad, some tramadol as well for the pain. And I just don't want to be on these kind of chemicals all the time.
But this year, Tanya decided she wanted to try medicinal cannabis as an alternative. She had no idea just what a mission that would be.
It's really frustrating because I can't find what forms I'm supposed to fill in, and all I can sort of find here, it looks like that this is actually for the people prescribing, not for the actual patients.
I think the biggest problem with medical cannabis is that people see it as, continues to be an illegal drug.
Dr. Rick Ackland is a pain specialist based in Christchurch. After years of research and weighing up drug relief for chronic pain sufferers, he's concluded that medical cannabis should be readily available.
The euphoric effects are seen in a very negative manner. Cannabis is complex, a very complex pharmacology, and has an effect on a wide number of organ systems, but in particular the central nervous system. Sadly, we are in a void over cannabis. The new government has certainly signalled its intention to allow better use of this product from a health basis. But it seems to me that if you have a terminal condition, you are able to access certain cannabis products. But in my area where people have chronic disability, and particularly significant pain symptoms, it remains illegal.
For Tanya, job one is an appointment with a GP.
Tanya, how are you? Good. Nice to see you. Thank you.
Dr. Hancock is not Tanya's regular GP. She's had to shop around, and there's no guarantee of a prescription.
I've been on these quite strong painkillers for quite a while now.
Yes.
Couple of years, and well, obviously, I mean, the painkillers do work, but not on the spasm. When I've heard that medical cannabis might be something that could work,
Like a lot of things, it's really a sort of we don't know how well it's going to work for you until you try it. And I've looked up a little bit because I, like probably most GPs, haven't looked a lot into the area because it sort of seemed like not a lot's happening in New Zealand so far.
A lack of knowledge, the stigma around cannabis, and concerns over limited clinical trials are all reasons cited by doctors for reluctance to prescribe.
I get the sense that politicians are more positive than the medical practitioners. Cannabis is a complex product. A good metaphor would be to say it's like the wheel. Those skeptics would say they just look at the spokes and say, look, it's not working. Whereas you've got to look at the rim and the tyre and the everything that goes with the wheel to make the overall effect. And that's what cannabis is. It's the overall effect of this unique plant.
The primary ingredient in cannabis is tetrahydrocannabinol, or THC. THC is the psychoactive that gets you stoned. CBD, or cannabidiol, is non-psychoactive. GPs are limited in what they can prescribe. Still, Tanya wants to give it a try.
There is one approved cannabis-based product that can be medically prescribed called Sativex. The one approved use is multiple sclerosis, and it has to be prescribed by a specialist, which is a neurologist. But you would actually come under the off-label uses for that, and we could start the Ministry of Health application for the Sativex on your behalf. But it's just a matter of form filling, sending to the specialist, getting the specialist to then pass on to the Ministry of Health, get their approval.
do you have any idea what the cost is of something like that? If to be on it for a period of time,
Ballpark 900 to 1,000 a month, maybe a little less depending on dose. So it's quite a lot. And
it is a lot.
Yes, and
It's rent kind of money, isn't it?
it's massive money.
The costs are prohibitive. From a prescription point of view, we've had Sativex, available UK product, and it's not funded, or hasn't been funded. And you're talking about $1,000 a month probably for these people. So it's out of reach for people who need it for therapeutic purposes.
I mean, obviously the cost is something that's just astronomical. You know, it's hundreds of dollars a week, and it's not sustainable. I do feel excited because I just feel like someone is kind of like on my side and thinks it's not a crazy idea. Like, to have someone that's going to take it in hand and make the applications, and that, in a month or a couple of months, I'll actually be able to try something different.
Tanya will need her application to the Ministry of Health to be supported by her neurologist. She's unsure how they'll react.
Cannabis has been needlessly vilified since 1937 when it was prohibited in America.
Dr. Graham Gilbranson is an Auckland GP, an advocate for medicinal cannabis and an addiction specialist.
Because of prohibition, it's been very difficult for researchers to study any benefits or harms from cannabis. If you look in the right place, we've got 750 pages of medical references in the Handbook of Cannabis. And over here we've got the National Academy of Sciences, which is loaded with medical references that talk about the degree of success by using cannabis products.
That research suggests cannabis products could be valuable in treating anything from heart disease and depression to pain and even Alzheimer's.
So I'm taking a view which is sort of there, and you've got the others over here, so we're polarised. It's very similar to the arguments we have on climate change at the moment. And it's difficult for either side to have an ability to interpret the data in a meaningful way.
I'm Sam Bartels. I have a PhD in computer science from the University of Waikato, and I work in the area of wireless communications.
I'm Brenda Bartels, and I have a master's degree in biology, and I'm an ecologist. This is Naomi, our newest addition. Oh, and this is Anya, our middle child, and we have a baby in heaven.
Yeah, our oldest daughter, Leah.
Anya has a rare form of epilepsy with a very poor prognosis. She's floppy and can't feed orally, she's fed by stomach tube, and she suffers uncontrollable seizures.
When Anya has seizures, she stops breathing, so she'll turn quite blue and stop breathing for about 30 seconds, and then she starts shaking.
It was devastating when it first started. Unfortunately, you do get somewhat used to it. It is always stressful, and you just have to, if you can, pick her up, give her a cuddle, make sure she can dribble because she can't control her secretions and things.
Incredibly, both Anya and her older sister Leah were born with the same condition. The odds were 1 in a million.
So she was on this awful cocktail of, 8 drugs, and none of them were doing anything, and they were like, we could introduce another one, and being an ecologist, I like everything to be really natural, so giving my baby a cocktail of drugs was pretty awful.
So I've just got some medications in the fridge here. We've got levetiracetam, which is an anticonvulsant. We've got omeprazole and domperidone, which are for Anya's stomach, for helping with stomach function. We've got Pedialyte, which is like Powerade, which is for when Anya's having trouble tolerating her milk. And then we have some medications pre-drawn up. We have some more. We have an arrangement of syringes. We've got Vigabatrin, which is another anticonvulsant. We've got drainage bags. We've got Midazolam, which is our emergency medication, which puts Anya to sleep if she's having seizures. Gabapentin for stomach pain. Lorazepam, which is how we get Anya to sleep at night, otherwise she just catnaps. And then we've got the usual sort of Pamol, Coloxil, etc.
A lot of drugs to go into a little body.
A lot of drugs, but yet nowhere near as many as what her big sister Leah was on.
Leah passed away at 2.5. Anya is now 4 years old, and her parents are determined that her little body will not be treated in the same way as her sister.
When it first came on the radar, probably around 2013, there was children in America that had been started on medicinal cannabis oils, and just the changes that were seen in those children just gave us hope. We can get the oil, which is 100% CBD, and I think it's about $600 for a bottle. And at the starting dose for Anya, that should last us maybe 3 months. But if we have to increase that dose, then we're probably looking at more like a bottle a month.
Someone needs to be with Anya all the time, one of us, so we can't both go back to work. And now it's quite difficult managing both children, so Sam's still only working part-time, so we don't even have one wage now. Yeah.
Two cannabis-based pharmaceutical-grade products are available in New Zealand for the terminally ill or those with specific conditions like multiple sclerosis.
What we've got here is the Tilray 100 milligrams per mil. It's an extract from the cannabis plants. It's made in Canada and it's imported into New Zealand. So it's an oil, so it's an oral drop, and it's often taken 2, 3, 4 times a day. So the Sativex spray is from GW Pharma in the UK. It comes as a pack for about $1,000. Well, in the last 5 months, I've seen about 120 people and written them CBD prescriptions. Most of the people who come to see me have pain.
People like Tanya. Remember, her legs are paralysed. She can't move them. They shoot out like this on their own, and these spasms cause her pain.
So these people have been tried on very strong medication, and in many cases the medication has given them side effects that have been intolerable. What I've found since putting them on the CBD, about 45% of them are reporting excellent or very good effects from the CBD.
In Auckland, Dr. Huhana Hiki has been readmitted to Middlemore Hospital with acute pain.
I'm having a flare-up, they think, of my MS, so I actually ended up with my leg burning and becoming paralysed down my right side. I have relapsing remitting multiple sclerosis, and what that does is the brain isn't quite connecting, the synapses within have been demyelinated. So it's like an electrical cord, and it exposes, the protection is gone, and it exposes the wires, so they all misfire in the brain and causes a bit of a problem. I was on over 100 tablets a day, and so it was morphine, gabapentin, tramadol, DHC continuum, codeine. Then I also had paracetamol on top of that. I also had within that drugs to counter the side effects of the drugs that I was taking.
Huhana pays $1,000 a month for her Tilray oil.
This Tilray I use is 10-10 THC CBD, equal parts, and grapeseed oil. That's all it is. And I use 3 to 4 mils a day, so it lasts just over a month. And it works. I just take it every day and I don't have any effects. I carry on like a supplement.
What about that cost and affording it?
I can't. In fact, I've spent over $28,000 on medicine. I can't afford it. In 2.5 weeks or so, that's the last of my medicinal. And unless they make some brave decisions very soon, it means I go back on morphine, etc., and my life is not going to be the same quality again.
Tanya has a way to go yet. First, she needs a neurologist to support her application to the Ministry of Health. She tries, and a week later, she hears word.
So I've just got this email from Julie Hancock, my doctor, and she's just told me that she's had a response from the Auckland Spinal Unit saying that they do not support or endorse the use of medicinal cannabis. We really needed their approval, basically, for the next step to get the medicinal cannabis. So It's pretty annoying, really. These are the people that have prescribed me fentanyl, which is 10 times stronger than heroin, but they won't support medicinal cannabis. My legs are just going crazy. A couple of times a day, I'll go like this.
In a few weeks' time, a government select committee will report back its findings on whether more people, not just the terminally ill, should have access to cannabis. There's big public interest. Some 2,000 people made submissions.
I think the government needs to get on board and support this for children like Leah and Anya, for adults that need this, but also just from a economy point of view, it's a great opportunity for New Zealand.
It's going to be some of our premier flower rooms, along with our vegetative state. All of our genetics will be housed over there.
So timetable-wise, I mean, obviously we're about a year deep into the project. I'm just thinking, you know, in 6 months' time, we should have the outline of all of these rooms in place.
Paul Manning, a former advertising exec, and US biotech entrepreneur Matt Roden are speculating on a change in the law. They're part of a Kiwi US outfit called Helius, which has already put together $15 million in startup funding. They are that confident that regulations over manufacture and supply are in for a radical overhaul.
Helius went through a capital raising process with our partners Deloitte, and what we've done is raised $15 million from New Zealand investors, which we're going to invest in its entirety actually in the next 24 months here in New Zealand. Most of that investment is going to go into building the Helius facility, and at the heart of that facility is going to be a cannabinoid research hub, which we want to build into becoming a world-leading centre for cannabinoid research.
The facility that we're going to be building here is a state-of-the-art facility. This facility comes to some of the most stringent GMP-certified bioenvironment clean rooms that you can possibly do from a food consumption grade when it comes to medical cannabis. So I think the workflow of the entire place here really would be the mother in the genetic room into the seedling stage, pre-vegetation stage, and then obviously the final flower rooms.
Helius anticipates enormous returns.
This industry could be $1 billion industry, certainly if you bring export into the equation. So that gives us an opportunity to add to the economy, to create hundreds of jobs, and to actually help people in New Zealand who are suffering. The Ministry of Health ran a survey back in 2016, and that said there were 235,000 New Zealanders regularly using cannabis for medicinal purposes. So that's about 1 in 20 New Zealanders.
The reality right now in New Zealand is that there's a fundamental disconnect between the law and reality when it comes to people self-medicating with cannabis.
Well, sadly, when patients come to see me, they very often report that their doctors are unable to help them, or in particular, the specialists are saying there's not enough medical evidence. Any concern about danger probably comes from the risks from prohibition. People are growing their own or buying it on the black market. They don't know what contamination from sprays or fertilizers or mold, what can be in that bag of cannabis that they're getting. With medical cannabis, we're talking about standardized products that are organically grown and certified safe from contaminants.
After the spinal unit declined to support her application, Tanya's trying again, this time with a private neurologist.
Hi there, I'm calling because I have a referral from my GP to see a specialist It was sent on the 30th of May. You should have a copy of that. They don't seem to be able to find the referral, so they've just put me on hold to find it. No, the Wednesday the 18th would be fine. Now, is there a charge with that? How much would that be? $500.
I never really thought about it as I went through my medical career until I started working in the area of disability and people with severe spasticity in particular and pain, but struggling to cope with immobility in particular. And then I've got a patient who's used a wheelchair for 30 years, and he takes one capsule of cannabis oil every night. And I said, what about pain and spasticity? He said, it does me well.
Weighing up all the costs involved, Tanya has a difficult decision to make.
I really don't know what to do anymore. Like, these spasms, just like, I mean, they're driving me crazy. So I've been to the GP, and now they say, got to pay a neurologist, I think it's like $500. And then I don't even know whether they will prescribe the medical marijuana. And if they do, it's going to cost up to $1,500 a month. But I just feel like completely out of options. It's like, I kind of feel like I have to see if that works.
Yes, yeah. That's a lot of money. You couldn't afford to pay that much for it, could you? Not with a mortgage. No, that's quite a dilemma, really.
By having a conversation about the use of cannabis, I have more and more come to the conclusion that there is a place for cannabis products in healthcare. I don't understand why we are not accepting this for health well-being purposes.
We need to talk to the experts about good ways to provide medicinal cannabis in this country.
Next week, if we relax our laws about medicinal cannabis and cannabis in general, what might that look like? Welcome to California. Cannabis production on an industrial scale, specialist oils, you name it.
So it's going to be 5 milligrams per ball, so you can totally microdose yourself.
The sick and the needy are forgotten too much. We don't sell dope, we give back hope.
A safe alternative for people wanting off heavy-duty pharmaceuticals? That's next week.
Don't get in the way of a mom and dad who have a sick kid. Don't get in the way of a daughter of an elderly person who is struggling, because it's about their quality of life of their loved one.
Attitude was made with funding from New Zealand On Air.